All of the following are changes at birth except A. Decrease in pulmonary vascular resistance, B. Increase in systemic vascular resistance, C. Decreased cardiac output, D. Flow in series. 2. Correct answer C. Decreased cardiac output. First inspiration produces a marked decrease in the pulmonary vascular resistance. Loss of the low resistance placental circulation and the gradual closure of the ductus increases the systemic vascular resistance. Increase in systemic oxygen saturation due to removal of admixture seen in fetal life also contributes to an increase in systemic vascular resistance. Pulmonary and systemic circulations are connected in series. This means that systemic venous drainage is pumped to the pulmonary arterial circulation and the pulmonary venous drainage is pumped into the systemic arterial circulation. Parallel circuit is seen in complete transposition of great arteries, where the systemic venous drainage reaches the aorta and pulmonary venous drainage reaches the pulmonary artery. A parallel circuit is incompatible with life unless there is a provision for good mixing at atrial, ventricular or greater arterial level. Best option is mixing at the atrial level. Which of the following statements about infective endocarditis is wrong? A. Splenomegaly is more common in acute than subacute infective endocarditis. B. Disease manifestation occurs within 2 weeks of the cause of bacteremia. C. Cerebral embolism is more common in the middle cerebral artery territory. D. 5% chance of intracranial hemorrhage. Correct answer A. Splenomegaly is more common in acute than subacute infective endocarditis. Splenomegaly is more common in subacute infective endocarditis of long duration. Clinical manifestations of endocarditis generally occur within 2 weeks of the inciting bacteremia in 80% of cases. All of the following are seen in corrected transposition of great arteries except A. Ventricular septal defect in 75%, B. Subpulmonic stenosis, C. Complete heart block, D. Right-sided Q waves absent and presence of Q waves in V5, V6. Correct answer D. Right-sided Q waves absent and presence of Q waves in V5, V6. Ventricular septal defect, pulmonary stenosis and complete heart block are common associations of corrected transposition of great arteries. Since septal activation sequence is inverted due to ventricular inversion, lateral Q waves are not seen and right-sided Q waves may be seen. If a patient has hypertrophic obstructive cardiomyopathy with family history of multiple sudden cardiac deaths, left ventricular hypertrophy of more than 30 mm, all are needed except A. Brother should undergo echo even if asymptomatic. B. Beta blocker should be started. C. EPS to be done to exclude the need for ICD. D. ICD should be implanted straight away. Correct answer C. EPS to be done to exclude the need for ICD. Since several risk predictors for sudden death are present, it may be better to implant an ICD straight away without going for an EPS. Increased pulmonary capillary wedge pressure is seen in all except A. Cor triatriatum dexter, B. Congenital mitral stenosis, C. Diastolic left ventricular dysfunction, D. Pulmonary vein stenosis. Correct answer A. Cor triatriatum dexter. Cor triatriatum dexter is the partitioning of right atrium into 2 chambers and will not cause elevation of the pulmonary capillary wedge pressure. Cor triatriatum sinister or simply cor triatriatum, as it is more common on the left side, is the partitioning of left atrium into 2 which causes mitral inflow obstruction and elevation of pulmonary capillary wedge pressure. Which statement about the right ventricle is false? A. More basal attachment of the AV valve, B. Moderator band is present, C. More trabeculated, D. Septal attachment of AV valve. Correct answer A. More basal attachment of the AV valve. Tricuspid valve goes with the right ventricle and is attached more distally than the mitral valve. The attachments of the tricuspid leaflets are anterior posterior and septal. Moderator band contains the right bundle branch. All of the following are true about coronary bypass grafts except A. 8 to 12% of venous grafts are occluded at hospital discharge. B. Up to 30% of venous grafts may be occluded at 1 year. C. Saphenous vein grafts have better patency than radial grafts. D. 85% of left internal mammary artery grafts are patent at 10 years. Correct answer C. Saphenous vein grafts have better patency than radial grafts. Patency of radial grafts are better than that of venous grafts, though they are inferior to internal mammary artery grafts. Radial artery grafts are free grafts, while the internal mammary artery grafts are live grafts with the proximal end being still connected to the subclavian artery. They have good pulsatile flow and their sizes match well with that of the recipient coronary arteries. IABP may be used in all except A. Aortic dissection with aortic regurgitation, B. Acute myocardial infarction with ventricular septal defect, C. Post-CABG shock, D. Severe left ventricular failure. Correct answer A. Aortic dissection with aortic regurgitation. Aortic disease is a contraindication for introduction of an intra-aortic counterpulsation balloon. Aortic regurgitation makes IABP ineffective as balloon is inflated in diastole and significant aortic regurgitation prevents the function of a balloon pump. In post-myocardial infarction ventricular septal defect, IABP enhances the myocardial perfusion and reduces the left ventricular afterload, which reduces shunting across the ventricular septal defect. When transposition of great arteries is detected soon after birth, what is to be done? A. Arterial switch operation after 2 weeks. B. Arterial switch operation within 2 weeks. C. Arterial switch operation after 3 months. D. Arterial switch operation after 2 months. Correct answer B. Arterial switch operation within 2 weeks. Arterial switch operation should be done early because the morphological left ventricular muscle regresses. Since the morphological left ventricle is connected to the pulmonary artery in transposition of great arteries, the left ventricular muscle regresses after birth due to the lowering pressure load. If arterial switch operation is done after significant regression of the left ventricular muscle, it will not be able to take the load of the systemic vascular resistance postoperatively and will fail. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.